This is NOLAHI, which stands for the New Orleans Healthcare Innovation Challenge, and we're here today to pick a winner for our contest on innovation in healthcare.
Healthcare is a big space. It's in constant change, and it's in constant need of innovation. And being the largest healthcare provider in the state, we recognize that we want to be on the cutting edge. We want to provide the best possible care and health opportunities for our patients, and for patients across the world, frankly. And so it's important for us to sponsor events like this to be able to demonstrate our commitment to innovation in healthcare.
Blue Cross is really interested in solving big problems in healthcare, and we don't think you get there without innovation and doing things differently than we've done before. And so the challenge this year is to find solutions in the area of social determinants of health. It's important to look at the entire individual when it comes to healthcare, and the social determinants, where you live, how you're educated, the resources you have in your community, are important things for helping improve the health and lives of those who live in this state.
Blue Cross's mission, as you know, is to improve the health and well-being of all Louisianans. That's a big challenge. As you know, Louisiana ranks somewhat low nationally. There's a lot of challenges in the state, and we think it'll take a lot of innovation in healthcare and all the services surrounding healthcare to actually improve our rankings. To that end, I think the largest providers such as Auctioner and Blue Cross can play a big role in combining our forces to spur innovation in the state. And I feel this is one way by which we can do that, to invite entrepreneurial energy in the state and try to solve and look for solutions for our healthcare issues.
Very prominent in our strategy at Blue Cross is the fact that health and the quality of health and the cost of health is key for our state and the citizens of our state. Making sure that Louisiana is seen as an innovative catalyst in that regard, improving health of our citizens, our members, and our customers is the way and the path that we see for success, not only for ourselves as an organization, for the healthcare delivery system, as well as the state itself. So participation today is a way to highlight the city of New Orleans and the state of Louisiana, demonstrate our leadership in that regard, but mainly to improve the health and the lives of our Louisianan citizens.
A lot of people don't realize the vast amount of healthcare assets that we have in New Orleans. We've got a number of brand new billion-dollar facilities delivering healthcare. We've also got a number of medical schools, 2 downtown. We have teaching facilities throughout the metro area. So a lot of times people don't realize all of the facilities that we have in New Orleans. So we want to make sure that when people come into town to talk to the institutions and talk to the folks doing the research, that they also see we have the facilities to do some really impressive stuff.
Auctioner has a long history of innovation. From our founding, we have been leaders in innovation and looking for the best ways to change and save lives in the communities we serve. And so we have, in the last few years, really invested a lot in innovation, specifically around digital health, advanced analytics, and ultimately personalized health. And we know that we need partners to do that. That's why we work with Blue Cross and many others across the state and across the national ecosystem. And so doing a challenge like the New Orleans Health Innovators Challenge allows us to share to the entrepreneurial and innovation community writ large, here's some of the issues that we're facing. Do you have ideas? Do you have solutions that you can bring forward to help us solve them? And so today we're going to hear some great ideas on a challenge that we put forward around social determinants, which is a big issue that we're all trying to tackle. And we're going to get to hear some exciting new ideas and hopefully some opportunities to partner and help to push and drive innovation and ultimately health in this community.
Welcome everyone to the 2019 New Orleans Health Innovators Challenge. We are very excited to also boast that we are the banner bioinnovation event for New Orleans Entrepreneur Week as well. So, okay. My name is Jeanette Weiland, and I serve as the Bioindustries Attraction, Retention, and Expansion Representative with the New Orleans Business Alliance. And I also have the pleasure of serving as your MC today.
Look, you may be asking, this is our second year, why are we doing this? And I really think that there are really 3 compelling reasons. At the Business Alliance, we have 4 work streams: business attraction and retention, talent and workforce development, small business ecosystem development, and place-making strategic neighborhood development. And we believe that it's impossible for a city and its citizens to fully self-actualize without folks being healthy. At the end of the day, this competition, what each of you endeavor to do every day, is the perfect combination of economic development. Because economic development, if it really matters, if what we do really matters, it's about changing and transforming lives. And the breakthrough technologies that you'll be hearing more about do exactly that. And we are very gratified for all our sponsors, but particularly our presenting sponsors, because they have invested, they believed in this concept when it was really just being fleshed out, and they have been with us every step of the way. I want to say that a couple of statistical things, because if I don't say it, our team will be upset, because they went through and wrote really good talking points for me. So I want to make sure that I say a couple of things. First, we are gratified by the growth that we've seen in the Innovation Challenge. We've more than doubled the number of respondents. That's good. I think we also, and my team colleagues will correct me if I'm wrong, we have our first international respondent, so we're now global, which only is appropriate for a city like New Orleans that is a city that is rooted and based in creativity. It's the birthplace of a globally recognized cuisine, Creole cuisine, a globally recognized music idiom, jazz, and we are reclaiming our innovation leadership in healthcare, and we have a proud tradition in that. I want to bring your attention to sort of the banner there, and as I close, it really talks about the New Orleans advantage, and in many respects, it summarizes the New Orleans story. We've got top talent. You're going to see some of that today. You're going to hear from industry leaders who could be anywhere in the world, but they're here in New Orleans, they're in Baton Rouge, they're here in the state of Louisiana. Breakthrough innovation. We are so grateful. I see our past winner last year. Please stand up, sir, from Allergy. You'll be hearing a lot more from him, but he was our winner last year. He's from Florida, and he's back, and he's got a refined product. So you'll be hearing a little bit more about that. But we also have folks across the globe who have thought it worth their time to really present their breakthrough innovation. Elite facilities. We are in a wonderful Louisiana Cancer Research Center. We are one of only 17 U.S. cities with 2 medical schools. And so we have that type of outstanding personnel. And finally, and the reason why we're making a big bet on digital health is it really aligns with some of the incentives that we have at the state level. Digital media and software tax incentive, we've got an angel investor incentive, we've got an R&D incentive. So we really feel that there is no reason that New Orleans can't compete successfully on the global stage in digital health.
But thank you to everyone that's chosen to attend today. This is a great event, and we're very much appreciative of your time and energies today. I'm Darryl Langlois, and I'm the Senior Vice President of Strategy and Innovation at Blue Cross and Blue Shield of Louisiana, the largest health insurer in the state of Louisiana. Stand here proudly next to Amy Quirk, the largest health system representing Ochsner Health System, and it's our collaboration and partnership that we saw in the early days that would enable this type of an event to come to you today. And we were very happy to know when Quentin approached us in the second year and said, we're going to do this again. We said, wonderful, and we would like to make sure that Amy's coming along with us, and that was the case. So appreciate all of y'all's commitment as well. Blue Cross has the mission statement of improving the health and lives of all of Louisianians. And we serve 1.8 million citizens here across commercial insurance, across Medicare, across Medicaid. It's a wide variety of people who walk in all different forms of life. But we recognize that we have the responsibility to support them in their health, however they choose to access it. And so we stand here today committed to this type of an event. Innovation is one of our core values. And we believe that this is the way in which we can bring that to bear. We also believe that today is probably the most exciting time in history as we look to improve how healthcare is delivered. The change of pace in which innovation is occurring The way in which we're delivering that and the opportunities for people to live better and longer lives is never more prominent than it is today. And so it's very exciting for us to help deliver on that promise, and we stand ready for that as well. Mr. Mark Rippen sits here before us today. He was our winner last year, and Amy and Dr. Milani and a lot of us have sat down with him between last year and this year and continued to be encouraged by what he has delivered. And one day we hope that that thing is going to look a lot like what's on my wrist. And if you're not familiar, he has invented a prickless diabetes remote monitoring device. Just imagine the day if you're a diabetic, and Louisiana has its fair share of diabetics, that you no longer have to prick yourself 4, 5, and 6 times a day. You can simply put this thing that most of us wear, and it reports back to us and to our healthcare providers, and notifying us when we have a condition that needs attention. So, Mark, we appreciate your ingenuity and welcome you back this year. But this year's challenge is about social determinants of health. And if most of us who work in the healthcare industry every day, we recognize that it's not just the clinical solutions that improves our health or determines what our health may be. It is as much about the clinical solutions as it is about where we live, the air we breathe, the food we eat, and the manner in which we can access that clinical solution. Many folks here in the great city of New Orleans can't get to that care because they live in places where the buses don't come. The bikes are not always readily available, and so transportation is a concern. All of these things are the things that matter to how our health care is delivered, and so that's why we chose social determinants of health, and we look forward to the things that the challengers today, the finalists today, are going to tell us about. So with that, I'll just close by saying thank you for the opportunity to stand here today and tell you about our great company. Special thanks to Quentin and his team. You've done a fabulous job in bringing this to not only to Louisiana, but to New Orleans and making the light shine for us. Our partners at Oshner, we appreciate, and all the folks that are doing the hard work behind the scenes. With that, I'll ask Amy to have a few words.
Thanks, Daryl. I'm Amy Quirk. I'm the CEO of Innovation Oshner, and on behalf of IO and Oshner Health System, thanks so much for being here today. It's a real treat to be here with Blue Cross, Daryl and the whole Blue Cross team, and they bring them in force. So it's great to be with you and the New Orleans Business Alliance team. You've done a great job with this event, and we're just so excited to be here for the second year of the challenge. This is actually the 4th year that Oshner has done a crowdsource open innovation challenge during New Orleans Entrepreneur Week. And it's so exciting for us to hear new ideas, to put out the challenges that we're seeing in the everyday care when we are treating patients, and hear ideas from all around the country, from innovators and entrepreneurs everywhere, for how to solve them. And so it's a really, really great idea and a great opportunity to be here today. We are, at Oshner, innovation is what we do, and building on our founder's legacy, I'm proud to say that we're now national leaders in digital health, advanced analytics and machine learning and artificial intelligence, and ultimately in personalized health and medicine. And many of my colleagues are here today, and I just have to thank them for the work that they do to make this community healthier and better. Earlier today, we had the NOLA High finalists all out to our campus, and I got to show them our O-Bar, which is a first-in-the-nation Genius Bar, specifically for digital health tools and apps. And then I got to talk to them about our digital health programs that are completely changing the way we care for chronic disease and pregnancy and other conditions. These and other types of solutions are the things that we create at Oshner, and we get to create because of partnerships and people like all of you. And so it was really great to be able to share that story with the finalists and to think about how we could work together. And so it was that kind of relentless focus that we have on our patient, on innovation that solves problems for our patients, like our current programs, that led us to the Social Determinants Challenge with Blue Cross. And as Daryl said, this is a huge issue that we know is facing our patients from accessing the care that they need. Social isolation and how connected are you to a social network is really important. Can you afford your medications? These are the types of things that are not traditionally in the medical record that we need to understand better to help the community be as healthy as it can be. And that is our mission and our goal every day. Our Social Determinants of Health Challenge this year received over 20 applications. We've whittled it down to 2. We'll hear from today Frisia and Medox, and we're so excited to hear you guys. Thanks for being here. And they have the opportunity to win project funding, but also the opportunity to continue to work together. And I know we're all excited to hear from you. But first, I have a real honor to introduce Mark Rippen. Mark is the CEO of Allergy, the winner of last year's challenge, which was focused on diabetes care. And Mark's got a really inspirational story and vision, and it's been a real treat for our team to work with Mark over the last year as his project has advanced. And as we think about how his company could create economic opportunities here in New Orleans, and so we're just excited to continue that conversation. So I'm going to turn the floor over to Mark to kind of tell us about his Nolahide journey and his product, and then we'll get ready for the challenge. Thanks, everybody, for being here.
Hello, everybody. I'd like to thank Blue Cross Blue Shield and Ochsner Healthcare and everybody else, Stone Pigman, all you guys for giving us the opportunity to show that we're the winner and that we're still here, and by gosh, we're going to do it. So, I mean, some of you have heard this story before, but some of you haven't. So I'm going to tell you how I got here. This is like the last thing I ever wanted to do. I used to be the director of engineering for Stanford Research Institute Marine and Space Technology Group, and I was working on underwater sensors, electromagnetic sensors for littoral seawater applications for the Navy and Special Operations Command. And little did I ever think that what I did for the military would have any kind of bearing on reality. But one morning I wake up and my wife is a nurse at the time, and it was weekends and she likes to sleep in late, and she wasn't there. And I called her name and there was no answer. And so I'm concerned. I get up because this is very unusual, and I walk over to the living room and she's sitting there on the couch staring into space, and I go, "Hey, good morning, Sue," and just doesn't see me. She's like catatonic, and I realize she's having a low blood sugar. I better do something. So I go to the refrigerator, I get some orange juice, I make her drink it, and then like 10 minutes later she goes, "Well, where am I? Where am I?" And I said, "Sue, you're home. You're okay." But the next day I said, man, what would have happened if I slept 2 more hours? She would have gone into a coma. And even if you're in very good shape, the chances of you coming out of a diabetic coma are not too good. Sugar is just like oxygen as far as the brain's concerned. And so I said, I've been doing all these projects for DARPA, and you know what? This is my new DARPA project. And so I did the analysis just like I do DARPA thing. Is it possible? And then I discovered all this really crazy stuff that I did had direct relationship to solving the problem that 30 years of efforts have failed. But I had the key to making it work. And that was just an act of God. Later on, as we're developing this device, thank you for selecting us and giving us the traction that we needed. I closed the C round for $1.2 million, and that's given us enough to go through. We'll be doing some trials at Cleveland on this device. This is actually a real product. This will be our Generation 1 clinical product for hospital, for ICU applications, as well as for diabetic people coming in that have to stay there for 5 or 7 days. And it'll also help eliminate the number of pricks they get while they're trying to stabilize them in the hospital. So the real target that we have, obviously, is this. And I'm right now raising the next round because to make an ASIC chip, which what we need, is going to cost a little bit more money. But I would like to emphasize that I've been very impressed with the caliber of the medical community here in Louisiana with the legal assistance we've gotten from Stone Pigman helping guide us through the landmine filled the process of doing what I'm doing. And I look forward to working with Ochsner and as well as Blue Cross and Blue Shield. I mean, Ochsner's world famous for their health analytics and for the things that we're going to want to tie into. And I'm looking forward to not having to reinvent the platforms you already have on the software and the application side, and the platform to the hospital and the care providers and such. And so I can just focus on the hardware and then basically making this smaller and getting it to work, and then being able to get it to everybody so that they can monitor themselves. And like in my case, the reason we came up with the word alert G is to alert us if there's a problem so we can take corrective action. And so the G was for glucose and the Y is, well, because we need it, right? So that's kind of the story. So again, thank you so much, Blue Cross Blue Shield and Oshner Healthcare, Stone Pigment, and everybody else in the NOLA team, Sally, everybody, thank you. You're doing a great job. This is what makes it possible for guys like us to get it, to make it happen. So thank you.
So now we will begin the pitch portion of today's event. We'll have a 3-minute pitch with a 7-minute Q&A period with the judges. And can we please welcome Elnaz Sarafyan, CEO of Medox, to the stage.
Hi everyone, my name is Elnaz. I'm here today to introduce Medox platform for standardizing social determinant of health. Just a short review on the problem that we are solving. Most of healthcare organizations collect social determinant data in the format of paper questionnaires and interviews with patients. That leads to unstructured, unsystematic, and not standardized data across different healthcare systems. So unsystematic data collection leads to scattered data across various EMRs that would prevent taking interventions for a targeted population. So getting a better handle on them can yield a significant return on investment and improve community health. At Medox, we help hospitals to securely capture and centralize social determinant data. This is how it works. EHRs have a pool of data collected from various resources. Medox gets integrated with the hospital's EHR and reads collected data across various EMR services. Then the platform detects missing data points at the social determinant key areas at the patient level. Medox sends an automated text message direct to the patients so that to collect the missing data points across the social determinant key areas. All data gets collected in real time and gets mapped inside the hospital, so leading to standardized data across all healthcare systems. We have designed the feature of sending questionnaire directly through text message with hard-to-reach patients in mind. There is no app to download, no logins, no account verification. Also, patients can receive questionnaires in their native language. As a result, we have been able to reach out to 96% of our patients. So by standardizing data, we can understand and codify population characteristics and needs and provide targeted interventions. For example, in 10,000 population, we can codify that 834 of them are diabetes and 223 of them have uncontrolled diabetes. And if we want to go on a deeper level, we can codify that 56 out of 223 of them have co-occurring mental health diagnosis, did not graduate from high school, and are non-native English speakers. At the same time, by standardizing data, Medox provides crosswalk with other national initiatives. So far, we have integrated with 4 EMRs, and our results show that it takes around 4 minutes for patients to respond to the questionnaires, and they feel comfortable doing it from the comfort of their home. At the same time, understanding patients' needs lead to new community partnerships. Our business model is simple. There is one-time fee for EMR integration that varies based on the type of EMR that we will integrate, and then we charge 10 cents per field questionnaire. And that's why we call our business model value-based. This is our team. Besad is a surgeon at Kaiser Permanente Hospital. I'm a PhD in educational technology from Hofstra University, and our technical founder, Ali Alavi, is a PhD in computer science. And I highly encourage you to text social determinant of health to this number and launch a demo of the questionnaires that patients will receive. Thank you. Medox platform helps hospitals to automate outpatient follow-up procedures from preparation to post-discharge. We make sure that all patients show up to the surgeries or any type of procedure prepared, and at the same time we follow up with them to make sure that they are going through enhanced recovery after surgery. This is where we started our journey. And then we expanded our platform to collect social determinants of health across different healthcare organizations. Medox gets integrated with the hospital's EMR and detects all data points across various EMR systems. Our system detects missing data points and sends a questionnaire directly through text message to the patients to collect missing data points. Then all data gets collected in real time and gets mapped into hospital's EMR. So basically, we can automate any type of communication that happens with the patients outside of the hospital. And then we engage with them by sending videos, surveys, and reminders to increase their awareness about different preventive medicine or any other type of instructions that we need to deal to the community.
We're excited to learn more about what Ochsner and Blue Cross Blue Shield of Louisiana are doing together. My name is Dr. Hillary Hatch. I'm a clinical psychologist, and I'm here to talk to you about Freesia. But first, I want to talk to you about May. So, we talk in healthcare all the time about silos of data, but the ultimate silo of data is May, because she knows everything that's going on with her that she's not necessarily telling you. She's got some recent changes in her life. Her children have moved away to Houston. She is missed a recent appointment. She's at risk for filling her next prescription, and she's got an appointment today, but she's a little embarrassed and doesn't want to burden her doctor or any others with what's going on in her life. We know you want to reach May and get her help that she needs to be able to stay on whatever care plan she's on. Here's how we can help with that. So Freesia is a patient intake platform. We are checking in patients at 70 million visits a year. That means our provider network is 40,000 providers. We work with large health systems, some of the biggest payers in the country. We work with some of the smallest 2 and 3 doc practices. I want to explain to you how the product actually works. So if you're going to your appointment, you will be sent from Freesia either a text or an email and to check in for your appointment. And all that paperwork that would be on the clipboard, including social determinants, if that's now the new paper that's there, that's all going to be sent to the patient ahead of the visit. They can fill it out in the privacy of their own home, on their own time frame, and in the way that they prefer. They can fill it out on their phone. They can fill it out on the computer. They can show up in the visit and not have done it yet, because that happens all the time. And then in that case, we can either push it to their phone or have them fill it out on a tablet in the visit. That diversification of channels to communicate to the patient is really key to reaching the broadest population. So we have a self-service utilization rate of 80%, which at 70 million visits a year is really something we're incredibly proud of and is really in the ethic of our company. We realized as we were growing that being in front of the patient at this moment in their healthcare journey where they're coming into a visit, it's an incredibly privileged moment. They're thinking about their health, they're receptive to messaging about their care, and this is a moment where we can really have the opportunity to reach them. And so as we were thinking about this, we realized, and our clients were asking us more and more about social determinants. We realized this was an incredible, unparalleled opportunity to assess patients for their social needs and get them to the resources they need. So we already had experience and we already had expertise in engaging patients around behavioral health. So asking depression screening, substance abuse screening, and other types of screenings as a part of our protocols as patients are checking in, updating their demographic information, clinical and family history, medication history. we already had this experience. We realized that it was just an obvious opportunity for us to expand our offering into the SDOH area. So we've launched a new product in that. It's already screened the first 150,000 patients. Their risks have been identified and patients referred to services in the same method that we've done other screenings. We're using that same method to screen patients for social determinants and to alert the care team that there's a patient in need. We have a platform that is completely configurable and individualized. So for Amy, who was talking about getting towards personalized medicine, we are able to assess May and recognize her urgent transportation need at the same time as we can see Nick coming in for a visit, a Medicare Advantage patient, and learn that he is having difficulties paying for his prescription medication. So we identify patient based on appointment type, eligibility, their diagnoses, and we know a lot of information about them coming into a visit, and that allows us to really individualize the engagement for each patient. So for Julian, whose mom is bringing him to a regular peds visit, we can be engaging her and doing screenings around asthma control, and then at the same time asking about triggers in the home, environmental triggers that might be exacerbating the child's asthma, and encouraging her and activating her to accept a home visit. So all of these kinds of resources are things that we would work with you to configure our system to be able to send patients to the different resources that you have in your system. So we have a motivational framework that we use based on motivational interviewing. We'll serve as your partner to help think about how to activate patients using the standardized surveys that you want to use, but at the same time really thinking about how to deliver the education patients need and the activation surrounding that. We have bidirectional EHR integration with all the major EHR companies. We are certified on Epic as a product that's available to users as a part of their app orchard. So we can talk in the Q&A what that means about where the data would be available to you. But it's really important to think about this in terms of social determinants of health. The diversification of channels to reach the patient, the configurability and individualization of our product for all different kinds of disease states and use cases, and how we partner and share data with Epic and other parties in the ecosystem. So our company's been around since 2005, but the social determinants product is new. So we're really looking for exciting partnerships like the one between Ochsner and Blue Cross Blue Shield, where we can really work with you to develop this product further and learn more about what it can take to make radical changes for your patients and your staff. So thank you again for having us here. It's a pleasure to be here. We check in about approximately 70 million check-ins a year. We have in our social determinants of health product has already screened 150,000 patients since we launched it very recently, identified risks in that patient population and alerted staff to their needs and gotten those patients to the resources they need.
After participating in last year's challenge that it was going to be easier this year, I thought I had some experience with it and it would be an easier exercise. Not the case. And my second comment is, I was sort of thinking about this before, and those of you who are old enough will remember the American Idol where there was this thing with Ruben Studdard and Clay Aiken, and actually both of them did quite well afterwards. And so that's kind of my feeling about the presenters here, that regardless of the outcome, both will do very well. So my job is to actually give you the criteria over which we did our sort of judging and look. And so initially there were, essentially there were 5 sort of general items, and the 6th is really the presentation itself. One was around the clinical benefit potential, which was really an idea around the ability of the product to affect patients and members in the community. The second was really around feasibility, and that is that it would be easy to execute on the plan as it was presented. The third was just the innovativeness. Is it a new, different, something that we hadn't seen before, or something that was done in a different way? The fourth was really the fundability, and this is this idea about how sustainable could the solution be without a little bit of venture capital? Is it really able to stand on its own? And then the last one was really on scalability. How do you take it from sort of the size it is now, and could you actually bring it to a large scale in a relatively quick fashion? And then the unwritten one was really were we as institutions able to sort of deploy it or execute it on a reasonably small scale? Could we actually jump in and do something with it tomorrow? So with that,
All
I'll
right.
give it to
Yeah, the drum roll.
the drum roll. The real drum roll.
Yeah. So I'll just ditto what Vendel said. This was closer than we thought. Last year we had the same problem, and I think we thought that would be a one and done, and not so. It's been both contestants did a great job, and we think both will be successful regardless. But with that said, I'm happy to announce the 2019 winner of the New Orleans Health Innovation Challenge as Medox.
Thank you all for voting for Medox, and it's a great honor to be here and present our platform. And we look forward to bring more values to the communities, which is the core mission and vision in our company and our team. Again, thank you very much, and it's a great event. Thank you very much, Sally, and all the teams that made it happen. Thank you. I believe that the fact that Medox is not only improving outcomes, but at the same time, we are reaching to the patients in the most convenient way, that is text message. We make sure that patients are on track for any procedure or visit that they have to go in a primary care, for a primary care visit, for a surgery, for anything. We make sure that they are on track regarding their health care.
Your reaction when they call out your name as the winner?
Oh, as a winner, unbelievable. I was so excited. So.
What is this going to mean for your company now and the patients that you serve?
So this is very exciting for us because we are actually considering New Orleans as the new headquarters of a company because of the great opportunities. It's a modern city with a lot of startups coming in. And at the same time, it's very exciting for us to work with Ochsner, Tulane Medical Center, Blue Cross Blue Shield, the trial that they're going to provide us. So these are all new doors that are going to be open for Medox.
Phreesia is a patient intake solution, and we check in patients at 70 million visits a year. We realized that was an incredible opportunity to engage patients around their social needs and get them to the resources they need. So we've launched a special product on our platform that engages patients around their social needs.
Your reaction to the entire process here?
Well, it's a fantastic team down here, and there's so much happening in the health innovation space here. It was just very exciting to be here and learn about what the different partners here, organizations, are doing.
Challenges like the one today give us an opportunity to provide seed money to companies that can solve some of the big problems in healthcare. We in particular are interested in social determinants because we think those kinds of problems aren't just solved by old methods and old strategies. In fact, if that were the case, they would be no longer problems for us. We're funding the startups to do work in this area because we think that innovation is critical.
I can tell you that social determinants play an enormous role in health outcomes, much more than I think people expect. And if we're going to be able to scale this, we have to be able to do it in some digital fashion. We cannot survive and scale this across a large population in an analog model.
There's a lot of research happening in the area of social determinants. Some of the research actually indicates that 80 to 90% of our health is dependent on social determinants. Now, these are things that happen outside the traditional healthcare system. We have a lot of data on procedures and visits to doctors. We have a lot of data on clinical values, your blood samples, and other types of measures. So we clinically have a very good picture, but we don't have data on what are your housing needs, what are your, do you have access to healthy food? Does someone live alone without many social supports? Do they need transportation help? Do they have financial challenges in filling their medication? This type of data is really not available in medical records. But if 80 to 90% of our health is dependent on all of these things that we call social determinants, it's critical that we collect this data and act upon it in conjunction with our health. If the health outcomes are poor because the surgery was done right, but everything that happened after the patient was discharged, because there was not enough support available, led to more complications, clearly the surgery was not successful. So we need to make sure that we collect this data. I'm very excited. This is a new area for entrepreneurs. There are not many companies around that are focusing on social determinants, but in today's challenge, we were able to find two who really are, and that's what we are excited about.
Incredible excitement. This is our second year, and I think we're getting better. We had two tremendous picks. Medox did a tremendous job with their pitch, tremendous product. And I really do think that you're going to see great partnerships with not only the companies, but within the health system and Blue Cross and Blue Shield as a provider. So it's going to be real innovation that's going to benefit Louisiana's both business as well as their lives.
Well, last year's challenge was great, right? We found a really revolutionary company, Allergy, who's got a really interesting piece of technology to change the way that blood glucose is monitored. It affects so many people with diabetes in this community and around the country and world. And so it's been fun working with them over the last year and seeing that product progress and continue to work with them in the years ahead is what we're anticipating. So that's been exciting. So the opportunity to find somebody else like that this year to work with us and think about how we can collect social determinants data and use it to impact health more positively in this community is really exciting to us.
I was last year's winner, and since then we've made some incredible progress. We're going to be doing clinical trials at the Cleveland Clinic shortly. We have a Generation 1 product that's good to go, and we were able to take the money that we won as our prize and invest it in making that all possible.
And what does your product do to help improve the lives of people?
Basically, we monitor people's blood sugars real time and alert them if the levels are too high or too low, so that people can make sure they don't get into trouble and they can probably manage their diabetes.
Your reaction to Blue Cross being involved in this project?
I'm very, very enthusiastic because it's important that everybody from the insurance side as well as the healthcare side and the health research side, we kind of put it all together, and that's what you need for things to work, everybody to be on a team.
What would be your advice to entrepreneurs and startups who are thinking about doing an innovation challenge and working here in New Orleans?
I think there's an incredible opportunity here in New Orleans, given the amount of resources that are available in this area here. You know, it's wall-to-wall research and hospitals, and there's a lot of potential here.
Healthcare is in need of an innovation. To us, the intersection between innovation and practical application is where success and future value is going to be derived. Entrepreneurs often bring that creative juice, that new way of thinking about things. Healthcare payers and providers are delivering day to day. Putting those two together in an intersection is where we really believe there's going to be value for our customers as well as the citizens of Louisiana.
I think to be a leader in the tech industry, you have to be visible on a national scene. That's why NOLA High was founded, and that's why it's so important to have our partners like Blue Cross Blue Shield of Louisiana as well as Ochsner and figure out the solutions that they need, and then we go out to a global audience and a national audience as well and say, can anyone solve these problems? These are things that we're looking for solutions for in Louisiana, and we're actively looking for partners to help us solve those challenges.
Each type of data that we collect on the member is collected for a different purpose. Claims data was originally, and still is, obviously collected to find out every payment event and make sure that people get paid for the services that are rendered. Now, that has every event recorded. So for example, if you go to your PCP, you go to your pharmacy to pick up medication, or you go to a hospital, or for that matter, you could be traveling and get hurt on slopes of Colorado, we collect all of that data. What we don't have is rich clinical data about those events, which obviously resides in the provider institutions like Ochsner. If a surgery was done at Ochsner, that's where the clinical data is. So you need to combine all of this data to make a complete picture of that member. And in each case, we have resources at Blue Cross, providers have resources who can act upon that member, and then certainly the society at large, the social supports as we call it, they may be a member of a church, they may be a member of a community. Family members may need information about what's going on with their disease. So there are other stakeholders all around that member who can also support. So our goal is to collect all of this data, apply analytics on it, and then create the right actions for every stakeholder who surrounds the member. And that's going to deliver the best outcomes.
We know that social determinants play a big role in health outcomes. Knowing what issues individuals have allows us to personalize the care we provide to them to give them the best opportunity to achieve the best health outcomes possible.
But we know that only a small part of the healthcare delivery system is responsible for the health of individuals. Much of that health is determined around the environment that people live in, the jobs they have, the contributors to their health. And so digital solutions are important in that space because that's the way to scale and to bring solutions to those who would not otherwise have those solutions. The data is the first step in designing solutions to solve those problems.
We know that health outcomes is impacted by much more than what's traditionally in the health record. So it could be things like, what is your social network? Do you have social connections or not? Can you afford your medications is a big issue and a big barrier to people reaching their health goals. It could be transportation, socioeconomic status, health literacy, you name it. There's a long list of factors that are traditionally not part of the health record that we want to bring in and start looking at so that we can partner with our patients to help them solve those barriers and help them reach their health goals. And so, the opportunity to find a digital solution to help us bring all of these different data points now into focus so that we can understand an individual's health story and that we can partner with them to help improve their health and ultimately to improve the health of this community, this state, and beyond is super excited. So we're really excited about this day.
We have 1.8 million customers in this state. If we're not going to lead, the question is who will? So we believe it's incumbent upon us as an organization that serves that many citizens here in Louisiana, along with our trusted partners, the healthcare providers in the state, folks like Ochsner, and then collaborating with NOLA Business Alliance is just the right way that we should be seeking these answers and bringing value to our citizens and our customers.
The finalists next get to meet with our partners like Blue Cross Blue Shield of Louisiana and Ochsner, and hopefully the next step for them is a real live working pilot agreement where they can test their technologies in Louisiana. And of course that helps our institutions, but the main goal is to bring better and more effective care to residents of Louisiana and New Orleans.
Most people think about the ways to address cost by looking at the efficiency that's derived. And we think that gathering information in a more efficient manner and applied in ways that haven't been done before allow us to deliver care in a less costly way than it's been done today. Prevention of those problems is a key in looking at social determinants, and that's critical for the work that we're doing in the state.
Payers, obviously, by virtue of what they are, pay for the care, and moreover, they have the total cost of care for any individuals. Healthcare systems like Ochsner deliver healthcare. So they both have pieces of information that are important in providing care. What we're trying to provide is what's the most economical and cost-effective way to provide that care, and payers have that same interest as well. So it's important for us to collaborate in things like this to develop new methods of delivering care.
Blue Cross in particular is focused on using predictive analytics in healthcare. The idea there is to find individuals before they have a healthcare problem. Use of this information allows us to target interventions and partner with providers like Ochsner to bring innovative solutions to the table. Without that kind of prediction and targeting and interventions, we would not be able to achieve the results that we're seeking.
It's really exciting to see so many people come together and acknowledge that this kind of tech transformation can take place in Louisiana. And we've shown people from across the country that we're ready for it and that our anchor institutions are looking for those next level solutions.
Second year, really great results. We're thrilled to be a part of this. We truly desire to see the innovation that occurs in this space, and today is another example of that. Social determinants of health is so critical. It's so front of mind for us and for a lot of folks in our state, and to see the types of things that we've seen today is just tremendous, and we look forward to the results that come from that.
This has been an outstanding forum where we've been able to see really innovative thoughts being proposed. This is a great platform for people to present those innovations, and we're very excited about the outcome of today.
This was very exciting. For the first time, we saw a field of contestants, if you will, over 20, who actually are focused on social determinants. The winner clearly embodies all the things that we want to see. Collect the data about social determinants, provide that data in the care process, and allow the members, all the stakeholders, to act upon that member in a specific manner to overcome those hurdles to deliver the best outcomes. This is very exciting. This is just the beginning of the journey.
It's incredibly bright. We've got a lot of work to do, but we're really optimistic. If you think about it, in our only second year, we not only went international, but we more than double the number of applicants. So we really look forward to what we're going to do in years 3, 4, and 5.
We're really happy with the presentations today. We're so pleased that our contributors have brought such innovative solutions to the table. It's a great thing every year to see the innovations that are happening in the environment. You can read more about it at our website, www.bcbsla.com.